Alcohol and other addiction has taken over the workforce. 49% of workers have some sort of substance use issue. So when you consider those odds, it's immense. One of my favorite things about the Ridge is the Ridge Professionals Program. And I think to understand the Professionals Program, first you have to understand its origin. Dr. Jeff Stuckert was our founder, and he was an ER doc, very successful, but also an alcoholic. And he had gone into treatment at a hospital inpatient program where he said he felt very much like a number. And when he got into recovery, he really wanted to create an environment for professionals like him to receive truly individualized care. And that's how the Ridge and the Ridge Professionals Program was started.
One of the best things about having two full-time addictionologists is that we are able to provide individualized care from a medical guided standpoint. We also then are able to specialize and qualify for treating licensed professionals.
And they receive very individualized care in the program and a curriculum that's very specific to some of the challenges that they face in their day-to-day careers.
And I remember the first time I went up to the Ridge when I was considering taking this job and walking in and going, I could stay here. It's very comfortable. It's a great place for people to sit and talk and be contemplative, quiet. It is a serene area. Of course, 51 acres, it's really nice up there. So it is a great environment, conducive to learning versus the hospital type environment that some people have experienced. No, this is a different experience.
So part of the Ridge executive suites include 6 private rooms with attached bathrooms to each one of those rooms. It also has their own group room and a business center that's available to them to work from.
And many professionals are often hesitant to even seek out treatment because they're concerned about their identity becoming known. And the setting itself lends itself to a great deal of privacy. The Ridge is very small and allows for individualized clinical care led by 2 addictionologists and a highly regarded clinical team.
Dr. DeRodes and I are both board certified in addiction medicine. It presents a lot to the table in terms of offering patients flexibility with regards to treatment. And the counseling staff couldn't be better. It's a great mixture of approaches for our clients. I'm an internist and Dr. DeRodes is a psychiatrist, but we've both independently obtained our board certifications in addiction medicine. It provides us what I call the depth of knowledge with regards to options for treatment and recovery, not only in terms of flexibility for treatment outcome, but medication utilization for patients to assist if they have anxiety, depression, as well as the FDA-approved drugs to assist in recovery from alcohol and opioid addiction.
So we have the opportunity to help individuals with co-occurring disorders, and it's actually very important for many people. Mental illness goes hand in hand with addiction. It isn't 100%, but it's actually probably more common than most people would realize. And here we have the option to assess for that and provide treatment if it's needed.
Although it is important clinically for us to ensure that our individuals are focused on their treatment above and beyond all else, we also recognize that professionals in particular still need to keep some connection to their work lives in some cases, whether it's to do continued education for their licensure or they own their own business and have to stay connected for the viability of their company.
I decided that I was going to do something I had never done before, and that would be to do a 30-day inpatient rehab. So my wife had asked me, and I had gone to her and I said, hey, look, I need help. And she said, you really want to do this? I'll look for some places. And I said, yeah, I need to do this. And she found the Ridge online. I was looking for something as a professional that would fit my needs. And then the Ridge offered all that to me So that was probably the biggest selling point. I mean, the accommodations were fantastic with the meal prep that we had here. The chef was great. The rooms were, this place is fantastic. It's a, very clean, well-run facility. They treated you, with dignity here. I liked having the one-on-one, counselor that was assigned to me, and then I met a lot of good friends. The camaraderie was great. People that I'm still friends with today. And then in just the structure of the actual, the daily care or the meetings and things like that really worked for me.
Following their residential stay, not an inpatient stay, a residential home-like stay, they participate in a year of aftercare. And I think that that's absolutely critical. Professionals are going to be returning to their high-stress lives and environments, and that aftercare provides them with the backup and the support to help them cope with potential stressful situations at work and find success in their recovery and their professional life.
I liked aftercare so much, I actually stayed an extra 6 months. So aftercare set for a year, I actually stayed an extra 6 months after that because it was just a rewarding, it's what I needed. I needed that connection to the Ridge when I left. It kept me, I really think that's one of the main reasons that it kept me sober.
So my hope is that when patients leave, they'll pick up some of the tools that we've offered them and then utilize at least some of those tools to maintain sobriety.
Our alumni and their families actively mix in with some of our current clients at the house and our aftercare clients, and really give them that vision that recovery is possible. They're able to see these alumni that are from 5 years on in their recovery, very happy, very successful, very close with their families. Families get their loved one back. We get to see people get their lives back. We get to see people get their careers back or find their happiness again. And so it's a cycle of inspiration. It's fantastic to see.
Life is remarkable for me. Life gets good really fast. The miracle of sobriety is that, my children are back in my life today, and I have access to my grandkids, and that in itself is a true miracle. Everybody has hope, regardless of your situation, how good or how bad you have it. If you want to get sober, you can get sober.
What I would say to employers, business owners, HR professionals is reach out, call us, and we can give you the right information about treatment and the program options to make sure that your employee is taken care of and that we're able to hopefully return them back to work to you more engaged and productive and healthier than ever.